All right, guys. This is Shiva Birdie. I have Don Schomer here. We're over at Banner MD Anderson Cancer Center and Gateway Hospital. I just want to welcome everybody to our inaugural Journal Club. We have what we think is a very exciting article and very, very relevant to where Banner is as an organization and where healthcare is going across the nation. Hopefully all of you have received the article in the email and have a chance to review it. It's Building a Strong Services Brand, Lessons from Mayo Clinic. It is a case study from the Harvard Business Review done by Leonard Berry and Kent Seltman. And we're going to let Dr. John Schomer kind of lead us through the article, some of the key points. He's the primary moderator for this month's discussion. I just want to reiterate, I'm really thankful that all of you guys could make the time to do this. This is excellent. The attendance so far, from what I can see, is fantastic. Please feel free to make any comments, suggestions, or whatever it is that you need to, and be proactive about the involvement, because this is really our experience together. So the more we're involved in this, the better we'll all grow as leaders. So Dr. Schomer, take the lead.
Thank you very much. So we chose this because I think it's a very timely article for where we are right now and where we are as Banner Medical Group right now, and maybe give us some direction as where we want to go. Also, I'm hoping that people will really chime in and contribute to this. I have a few slides here that kind of just gives an overview of the article, and then finishes with some questions. We don't necessarily have to go through those questions, but if other people have other insights or other questions, let's please bring those up. So starting, what is a services brand? Well, really, a services brand is nothing more than a promise about the nature of a future experience a customer will have with a service organization. And that's important because with a service organization, it's very hard to get a test drive. So this is basically a chart from the article that describes how to understand a services brand. And so you have the organization's presented brand, and that's basically the communications controlled by the organization. Those are like advertising, direct marketing, etc. And that leads to brand awareness. There's then organizational influence communication, and that's actually that's a customer's experience with the organization and what those customers then communicate to others. And these both can lead to brand awareness, which is nothing more than a customer's recognition and recall of that brand, and brand meaning, which is the dominant perception, which is hugely important, of a customer, how they perceive that brand, which can lead to brand equity, which can be either a positive equity, if it's an advantage, a competitive advantage, or a negative equity if it's a disadvantage. And an example might be, say, a Yugo has a negative, if they even exist, has a negative brand equity. So why the Mayo brand? Well, this was actually from 2003. This was a survey that was conducted across the entire United States of 1,000 people, and Mayo is probably the most recognized healthcare brand in the United States. 95% of patients report positive things to say about the Mayo Clinic. And those patients, or those people, speak to between 44 to 47 different people. So huge, huge impact on Mayo's brand equity. And this is despite a almost negligible marketing and advertising program. So just some of the take-homes from the article. What were the contributors to the Mayo brand? Started off primarily outcomes and scientific research. There was a culture of putting patient interest above all. There was medical specialization in teamwork and physician leadership. Another thing very similar to at least the MD Anderson Houston and also MD Anderson Banner is salary compensation for the clinical staff rather than a typical fee-for-service private practice model. They codified the culture with the Mayo Clinic model of care. They had extreme operational efficiency. They have a subscription newsletter, and they aggressively protect their brand, so they're very defensive of their brand. And so the takeaways that from the article is, I think number one for me was actually the last one in the article, was turn your customers into marketers. They play defense, not just offense, and they attend always to organizational values. And so here is just some suggestions for points of discussion, but I'd like to turn it over to you guys.
This is Shiva Birdie. One thing I wanted to reemphasize, going back to our first slide here, that to me really stood out, and again kind of put forth the importance of this, is tremendous amount of resources and money is spent on organizations' presented brand and the external brand communications and controlling those. But not very many organizations focus on the last. And I know that Banner is putting a tremendous amount of work into this, but it sounds like, given the dotted line meaning a less influence and a solid line meaning a solid influence, the customer experience and what the customer has to say about the product means a lot more to the brand than anything that we're doing and spending money on in marketing. So it really comes down to the experience of the customer, and in our case, the patient. And I think that to me was a huge point that stood out as to why this organization was successful.
Could someone who's familiar...
Go ahead.
Go ahead.
We just heard the first part of that. Hello?
Yeah, we can't hear you.
Can you hear me now?
Yeah.
Okay. This is Betty Davis over in Sun City West. Could someone who is familiar with the Mayo Clinic system kind of go through like how many patients a day a doctor would see in that, as opposed to like how we do our clinic now?
Hey, Betty, it's Anton. I'd be happy to, if only because I work there, unless someone else wants to.
Please, Anton, go ahead.
So, yeah, it's interesting. It's an expensive business model, so their brand equity comes at a price. New patient appointments are typically 45 to 1 hour long, and it used to be even longer. As little as 15 years ago, a gastroenterologist would see 2 or 3 new patients in an afternoon. Some of them were unbelievably complicated and some were simple. But what would happen is that the patients got this impression that you had all the time in the world for them. So you then reap the benefits from their loyalty to the organization, and then they also started spilling the beans on all their other medical problems. And of course, you had the time to address them, so then that would generate multiple other consultations. And I guess they would make their money from the downstream revenue. But the whole model is that you've got all the time in the world for the patient. That's the one thing. So the specialities differed on how much time they got for appointments, to your question. It wasn't all that long, but they always, and we knew this working there, that it was always said that it's longer than anywhere else, and I'm not sure that that's factually correct or not, but patients would often give you that feedback. The other thing is there was a very strict dress code, which is you either like or don't like, and once you get used to it, it actually becomes fun, but the patients love it. So people walk around in suits, and at least patients see it as something different, and that helps differentiate Mayo from other places. That's been eroded a little bit over the years, but by and large, it's still held.
So Anton, the dress code was suits and not the white coats?
Yeah, correct. And it's been criticized by some for hygiene reasons, but it's and then they used to have and still have, particularly in Rochester, a dress and decorum police, which sounds terrible, and they may have come up with a better word for it. But if you walk around with inappropriate clothing, someone tactfully comes up to you and says, "Hey, won't you put on the jacket?" So if you kind of have to buy into it or not. If you don't like it, then kind of don't work there. But if you buy into it, it almost becomes fun. I mean, the dress and decorum police never said anything to me. I mean, it's not as draconian as it sounds. But there's this unbelievable, intense awareness that the brand has to be protected, and one or two people who don't believe in the dress code is not going to derail that. So they'll help you find happiness elsewhere if you don't want to sign up to that business model.
It's interesting. When I read this article, I'm reminded of the MD Anderson culture in Houston. It's virtually identical, which is also another strong brand. And we didn't wear a suit when I was there. We didn't wear suits. We had to wear the white coat, and they were the very nice, very heavily starched white coats with cloth buttons. And you wear them one day, and you have a nice, doctor had about 20 of these jackets. You wear them one day and then put them in the laundry and get the next one. And it was a pretty strict, you were expected to be in a pressed white coat. So, again, protecting the brand.
Anton, a follow-up question to something that you raised in here. Two things. You mentioned it's a very expensive business. Why is it expensive if it generates so much downstream revenue and loyal customers? And the other question is, what's more important as a healthcare not-for-profit organization, to create that profit or to continually create the brand? What do you guys think on that? It's kind of an open question.
Hey, it's Misty Johnson. As I'm listening to this, there's a book that I read, and it's a really easy read if you guys want to pick it up, called Raving Fans, R-A-V-I-N-G, Fans, Raving Fans.
That's an excellent book and a quick read. Yes,
it is. It's a really quick read. And what it focuses on is creating, defining your product, and delivering it consistently to everybody who walks in the door. And that's really what we're talking about. When we're looking at volume-based practices versus quality-based practices, this is going to be the theme for the future for how we get reimbursed for quality of care, not volume of care. And I think that Mayo Clinic is going to have a change in their culture a little bit. You're generating downstream revenue because of the patient comes in and these other consultants, but it's really going to come back, Shiva, to your point, I think, to the quality and how we're getting our referrals in. So if we're getting referrals, patient referrals, we're marketing, buying consistent product, we're getting those return patient referrals, and we're providing quality every single time we touch that patient. That's where we're going to get the bang for our buck in the future.
I think that's well said. To Shiva's earlier question, why is it so expensive? Well, they have to fund research and education, so those dollars have to come from somewhere. Now, to your point as well, it all kind of works in the end because their turnover is so low. I had a catch up with old colleague recently, and I asked him what the turnover rate is, and he said it was just above 1%. So if you think of what physician turnover costs from the Healthcare Advisory Board, we know that it's over $500,000 to replace a primary care doctor if you replace them in 6 to 7 months. You can see how quickly that pays off if you lower your turnover.
That's huge. One of the things that Shiva and I were discussing before we started is Banner has a brand, and Banner has a pretty positive brand. It's mainly around operational efficiency and a well-run administrative organization. BMG really is a new entity and doesn't yet have a brand. Should it be different from Banner? Is it the same? Do people have thoughts on that?
I do, but I'd be much more interested in other people's thoughts. It's a good question.
Hi, Anton. This is Ted. I'm sorry I joined late. I've been listening for the last 10 minutes up in Colorado. I do have a comment on that. I think they are different brands. One brand is when you're looking at a health system, what does that health system represent? And that is the quality, the efficiency, the things that Banner's been doing very well. When you look at a brand for then the Banner Medical Group, that brand is really going to be based on the customer experience, what kind of consistencies you're seeing, what kind of outcomes you're getting, and basically how friendly and well those patients were taken care of. And that's the brand that's going to generate your repeat volume.
Like Banner Health, Arizona's nonprofit healthcare leader with the University of Texas MD Anderson Cancer Center to bring unprecedented levels of cancer care to Arizona. We're proud to provide you with compassionate, comprehensive, and coordinated cancer care.
Okay, everybody is now muted. We're the only ones that can be heard. To speak, hit *7. That will unmute you when you have a comment. So if anybody, whoever was speaking, can make a comment now, that'd be great. You need to hit *7 and then you can speak.
Okay, I'm unmuted. This is Anton.
We can hear you.
Sorry, so Ted was, Ted, are you there? We didn't quite hear the end.
Remember, hit *7 to unmute and then you can speak.
Ted?
Until Ted comes back on again, one of the things that these things take time. Mayo Clinic brand wasn't developed overnight. We all got to know them whenever we were born, and in our medical world in the latter part of the last century. But I know, and I enjoyed when I was there reading the early literature from the founders. And there's a lovely library where you can go and read the original writings, and you get to see how unbelievably hard it was. All the stuff that the birth of a company, that leads to the birth of a company, it didn't happen overnight. So that's one thing to consider. The other is that Banner Medical Group needs infrastructure and structure more before it's going to become clear to us what its brand's going to be. I mean, yes, we want to be the best medical group in the country and all that sort of stuff, but the other stuff that goes, the nitty-gritty of what our brand is, will develop over time. Our strategy right now is to first develop the infrastructure of all the physician leadership and diet that go with it. And then we'll be in a better place to figure out what our thing is going to be. I'm not sure if that helps.
No, I think that's huge, Anton. And I would just like to add to what Ted was saying. I personally, and this is my opinion, think that BMG needs to develop its own brand. It's separate, but additive to the existing Banner brand, and I think that you bring a very good point. BMG is a startup, much like we are out here at the MD Anderson campus, and first you work on infrastructure, and then you work on defining the brand.
I want to reiterate to everybody, to speak, you have to hit *7 to unmute yourself. Another question I have for the group out there is does anybody think this is too oversimplified? I mean, all we need to do is have everybody on the same page and focus on our patients. Is that too simple to create a brand now? Does Mayo have an advantage because they've been in existence for 130 years?
Well, they have a huge advantage because they've been around for that long. But I mean, we can certainly, I think we can learn from what they've done. If you read the history, interestingly enough, if you read the history of MD Anderson Cancer Center, and they also have a wonderful library where you can read that. Monroe, David Anderson, actually was a patient of Mayo Clinic, and Mayo Clinic was the model that MD Anderson was built around. MD Anderson has now about 75 years of existence and a powerful brand. So, you know, I think that the Mayo brothers were clearly onto something for building an organization around a brand that's been sustainable for a long time, at least in 2 instances.
That's interesting. I didn't know that about the history of MD Anderson.
And it's amazing if you read the article. If you read the article, it's almost as it's describing MD Anderson Houston, the culture of MD Anderson Houston, the fact that employees of MD Anderson Houston have an esprit de corps. They feel like truly, I think they're better employees because they're part of that esprit de corps.
Any comments?
Anton, can you hear me?
Yes.
Well, you know, so getting back to the whole branding thing, and the article reflects on Mayo traditionally not doing all that much in terms of advertising and relying on word of mouth. I think that's worthy of further discussion. I've always been a believer that it's incredibly powerful, the power of word of mouth. I remember when I was at Mayo phoning an MD Anderson oncologist for a second opinion. And it wasn't just once, so I don't think it was a coincidence, it was twice. And I got through to him in no time. His secretary didn't make me feel like I was a bother. And I could kind of hear in the background, she said, "Hey, I've got Dr. Deck here from Mayo wanting to ask your opinion." And I could hear him say, "Hey, not a problem. He's never heard of me before." And I was put through to his office, and he gave me all the time in the world. And now I'm telling that story. So the power of word of mouth is incredible.
I think that's a good point. And you know, I can remember being faculty there, having people call, you know, all the time, even as a radiologist, and to discuss, I mean, people I didn't know, and it was that was very much the culture of the entity.
Yeah.
Is anybody online from either corporate or from marketing, from Banner or from HR, Diane, if you're on? If anybody could give us an input as to how Banner would compare to this with regards to marketing and what we do for marketing, you know, compared to this model. Remember, you have to hit *7 if you need to speak.
This is Laura Snow. I'm from the Strategy and Planning Department. And while we're not in the marketing, and I can't necessarily speak to the science of marketing as Banner takes a look at it, I certainly am familiar with some of the strategies that have been in play. And I think I'm just interested and curious to learn from the rest of the participants about what are the elements of Banner Medical Group or the aspects of Banner Medical Group that you think that differ from Banner that would lead to a different brand identity?
That's a great question.
Remember, *7 if you need to make a comment.
You know, just to make sure no one gets the wrong message, I don't think that Banner Medical Group needs a separate identity from Banner or needs to it would be confusing for the public, and Banner is aware of this in speaking to Julie Sherman, to keep it very simple for the public, you don't want to confuse them with a whole lot of brands within a brand. One of the examples that I've used before is as Banner Medical Group, Banner, and Banner Health Network mature, we are finally grasping those concepts. And not everyone, you'd be surprised how many people I talk to who aren't quite sure what Banner Health Network is, including BMG physicians. If I flew to Cleveland and got off the airplane to go to Cleveland Clinic, and I then got told, well, where exactly would you like to go, Mr. Decker? Would you like to go to Cleveland Clinic, the Cleveland Medical Group, or Cleveland Health Network? I would be totally confused, and that's something we need to be very cautious of. Banner's been very, very successful in its brand, and we probably need to try and build on that as opposed to reinventing the wheel with another brand.
You know, Anton, I agree with you with this one caveat. Banner Medical Group has Banner in the name. Banner has an excellent brand reputation for running hospitals, running clinics, and they have an excellent brand for operational excellence. As part of that, as part of its growth strategy, it has to go out and have lots of relationships with many doctors that are not BMG, that are you know, private practice, that are and nothing wrong or disparaging about private practice, but for the immediate future, Banner as an organization is going to have both BMG doctors and non-BMG doctors, and there is a difference, and we don't really want to be, I would think, and I just throw this out for people's thoughts, we don't necessarily want to impact or be impacted by non-BMG physicians or impact their practices.
No, you hit the nail on the head. That's such a tough one that we're all having to work through, because we need and want to make them feel welcome and part of the Banner magic, and yet Banner Medical Group has to be better than the best, and we can't be held back in any way by aligned physicians who aren't part of the group, and that challenge is not easy.
My concern is if customer experience with the organization is the most important component of this, do you think there is a difference in how customer experience is in somebody who's part of an integrated, BMG group versus someone you don't have as much control over because they have outside entities and outside goals and metrics that they're following for their own groups or practices? How do you move forward in an organization if, by essence, you are almost two separate things? I mean, there's one that involves complete integration and the others that isn't. So how do you move forward? And again, I don't have the answer, but that's a concern I have.
Shiva, this is Marga. In talking about the branding question, I'm going to take a step back and just say that for the difference between Banner as a system and BMG as a provider group, maybe there is no need for a difference in branding when it comes to the customers, to the patients. But there needs to be a difference in branding when it comes to providers, because you're branding this group, branding this operational arm, at least a part of the operational arm, to attract and maintain and retain one of the best quality providers you can. And that influences the outcome of Banner's system. So maybe you don't need a certain branding to a certain group, but that branding is required. And I don't know if that's different from what you guys are initially talking about, but there is an importance to do that within our own community sometimes.
So I'm not sure if this is what you were hinting at, but then is the client or the physician or the customer, the physician versus the patient, and that becomes an interesting discussion. I don't know the right answer, or that anyone knows the right answer, but one of the things we're trying to do in Banner Medical Group is get people used to the idea that BMG providers are our customers, and we need to provide a really good product to them, and from that will naturally flow better care to the patient. It's a little bit like running a factory where you're not happy with the final product. You can moan and groan about, oh, better product, but at some point you're going to have to figure out whether your machinery is working and whether your employees are having adequate breaks or well-trained enough. Until you address those things, the product that comes out of the factory is not going to be the best.
Yeah, that's a great point, Anton. I agree. I mean, I think to Betty's point of what makes a brand, and then looking at what are the processes in that, and every single aspect about that process, the branding within that, is that to the highest quality, highest standards, and is that given enough, you could say, attention that the final product, like you say, Anton, is coming out what you want. And that final product could be branding of Banner to the real customers, we can call the patients, but that is very strongly interlinked with the branding of every single aspect about that care that goes, and every single team member. It's providers, the nurses, the secretaries, and everybody who's planning how to give and provide that care. So I think branding in each element is to utmost important as well.
It's Misty again. If I could kind of take this to a really higher level view beyond BMG's brand and Banner Health as it's separate, and private practice aligned physicians versus BMG. I think for Banner Health to be successful, we need to look at it as this is a Banner brand, and there are maybe subdivisions underneath that include BMG and Banner Health Network and the aligned physician. But our success as a system, as an organization, is going to be that it's the same product regardless of whether they're aligned or employed, and that we set the same expectations with our aligned physicians as we do for our employed physicians.
Hey, Misty, I totally agree with you, and my eyes have been open to, because at Mayo it was either employed or nothing. I've almost been here for a year, and my eyes have been open to how very well Banner's done that relationship with aligned physicians, and what tremendously, maybe that's Banner's thing that MD Anderson and Mayo can't pull off, is that there's a middle ground of a Banner way with either employed or aligned physicians, and that's the magic, is that you can either go in and out of both, or be in. Maybe that's our thing, that Cleveland Clinic, Mayo, MD Anderson, Harvard, those places can't pull off.
Yeah, the Cleveland Clinic is not 100% employed in a lot of ways. They do have other smaller hospitals where they have relationships with the physicians that are there that are still private physicians that are working within the organization, and I think they're having a lot of challenges with those organizations, those particular hospitals as well. I mean, I've worked at a couple of them, and it was a very different experience. So again, my concern is, how do you get the customer the same experience? If this is sort of the be-all, end-all, and let's say it is, how does a customer get the same experience within the organization from what is, in essence, two differently driven entities?
Oh, it's so challenging. I don't know that I have the answer. I think it's a fascinating challenge, but you're right. The customer mustn't have to work it out. All they know is that they're coming to a Banner doctor. Once they have to figure out whether you Banner aligned, Banner employed, Banner this, it starts getting messy. I don't know the answer. That's absolutely the challenge.
And Misty, you're absolutely right. I mean, I think the focus should not be on separating the two, but it should be unifying it. I just think BMG actually has a considerable advantage because you can align fairly easily right off the top, because one, you incentivize differently, and you're sort of recruiting within the program a particular type of culture and a particular type of set of values that you don't necessarily have when you're not employed.
Right. Oh, absolutely. You're right. There's automatic accountability when they're an employee with those expectations, and so the challenge really becomes getting the buy-in of the aligned physician, the private practice physician who has their own mission statement, who has their own work, to be consistent with the philosophical mission of Banner and that culture. You're right, and like Anton, I don't have a good answer for how that happens, how that could happen either, except that it's worked reasonably well so far. But
well, if I could suggest, one of the things, I personally sort of think that the culture trumps all, and that aligned physicians will choose to be aligned because they want to be part of that culture, or choose not to be aligned because they don't want to be part of that culture. I think for an organization, that there are certainly successful organizations that don't go along with the typical strictly employed physician role that a Mayo or an MD Anderson handles. One of them that comes to mind is UPMC, is a successful academic organization that has taken sort of the opposite tack. And I just wonder if it's kind of, to use a tennis metaphor, if it's kind of like as an organization, we should either play the net or we should play the baseline, not try to play in the middle.
You know, this is Kevin McKay. Can you hear me?
Yep. Sure.
You know, I think Banner actually is moving in the right direction. You know, towards bringing everybody on board. They can't clearly afford to hire all the physicians right now, so they have to have another mechanism to get everybody under control.
Exactly.
And I think what they're doing is, you know, the clinical consensus groups are being formed and are getting more and more power to kind of standardize practice based on evidence-based medicine throughout the system to get everybody to basically treat the patient the same way. And then Banner is also using patient evaluation scores to try to get, you know, physicians to be nice to the patients and, you know, present a good image to the patients. And, you know, they have the language of caring that they're rolling out now. So, you know, I think these are all good mechanisms actually to achieve that across the board. And eventually I think they're going to have to get to the point where they're willing to drop physicians from the medical staff if they don't do well, you know, and I think that's probably heading in that direction, but I don't know that for sure.
You know, in my comments earlier when I said, you know, my thoughts are that patients get confused between all these different possibilities, Banner Aligned, BHN, BMG. Maybe I'm wrong. Maybe patients get it easier than I think. Maybe it's easier to convey the message that there's a Banner way, and that's done in one of two ways. You're either employed or aligned. Maybe that's not too much to ask of patients, but I don't know the answer.
You know, this is Dr. Haddad. I'm in pediatrics, and I just want to share a little bit about the concern I have about how Banner is approaching, like, the health centers and acquiring practices in pediatrics that is alienating some of the, you know, more successful community physicians, pediatricians that feel like Banner is trying to run them out of business and compete with them. So, you know, I just worry about that strategy and what it's going to do in relationship with the other physicians.
Imad, you're right. That is, we have to be so careful in how we communicate and work those relationships. And we have to remember that a lot of the aligned or private doctors have been incredibly Banner loyal way before the birth of Banner Medical Group. So that's something that will evolve, and your point's very well taken.
Yeah, you know, I think that the overarching theme in one of these things just to kind of bring it all together is, we're worried about, in terms of the language of this paper, is our brand risk. And it seems like the brand risk is easier to control within the BMG model. It's easier to control, and it's less easier to control outside of it. It doesn't mean at any level that the brand cannot succeed in both models. I guess the real challenge for everyone is going to be how we're going to keep everyone accountable to the brand. And it's accountability to our brand that we need to focus on. And I think if we do what we're doing, which is focus on the patient, and the only goal in the central sort of, the central driving factor, the only customer, in my opinion, should be the patient. If that is the goal and that's the central value of every physician or provider or allied health provider or administrator that comes through our doors, I think you're sort of mutually aligned. And it's not that we're trying to make each other happy. We're trying to make the patient happy. And that's the goal. And I think that's been the Mayo Clinic model. I think that should be our focus.
Yeah, when you work there, and I'm sure other organizations are similar, but they drill it into every single day that the needs of the patient comes first, and there are endless stories. There's the current CEO tells such a lovely story, and it's so powerful. He is originally from Canada, and he only came to Mayo in the early 90s, but he was a neurologist in Canada, and they had a visiting professor from Mayo who arrived late for the meeting, and they were all devastated, and the visiting professor was also devastated. And when they asked him, well, what happened? Did you miss the flight or whatever? He said, no, it was late Friday afternoon. It was 4 o'clock, and there was a patient who needed help, and I couldn't leave because they weren't sorted out. And they're just endless stories like that, and it becomes infectious, and either you sign up to it, like I said earlier, or you leave. And the only other thing I would say is one mustn't forget the small things. As I sit by my desk, my email's open. Little things like how the signature at the bottom of an email, that actually becomes, it sounds like, Big Brother looking over your shoulder, but how everyone's signature looks. If you're going to develop a brand, it has to start looking the same font, same everything. And it's not always popular. People don't necessarily like being told what to do, but that's the price you have to pay to develop a very strong brand.
Okay. Any other comments? Reminder, *7 if you guys want to speak.
Hello?
Yeah.
Hey, I'm sorry. I've been trying to just talk, and now I should. This is Abrar trying to get to. I should have listened to you before by doing the *7 thing. I just said it was a good discussion. I kept it to the last. I mean, I think it's a great comment. I mean, I think brand is a very, very complex symbol. I mean, if you look at it, we talked about attributes and the benefits, and what our customers would expect, or our patients would expect, and then there is a good talk about cultures. In terms of, some people feel comfortable providing that service wearing white coats and lab coats, and the others provide that suits, and then you have Banner where everything is okay. I think as long as it is in line with what a particular hospital or a particular organization can provide, I think all these other things can be flexible. But I think what's important is to look at, in terms of, I kind of look at it as like a pyramid, like, you have all these little attributes at the top where, how do you finally present the final product, and then you have these beliefs and values that is associated with that. I mean, it was interesting to go through that Mayo Clinic article, and, just when patients go there, they know that they will be taken care of. And I'm glad Dr. mentioned earlier that, I think we're kind of a little too optimistic and too energetic about how we can satisfy everybody. We have to pick between and very rationally pick between, are we going to be a volume-based service or are we going to be a quality-based? And somewhere we have to draw the line because, you know, when you're talking about spending an hour, hour and a half to a patient, which I would love for somebody to spend that much time with me, and at the same time you have to look at the large amount of volume that we have to deal with in kids of, you know, indigent care and all the other things. Somewhere we have to define our, you know, boundaries, keeping that in mind. And I think though we can have certain specific requirements, that's how a brand should look like. But I think all these other things do play into that. And the decision is more so, you know, either I think it's probably a terrible idea to employ all the physicians because the cost is going to be humongous. And at the same time, just developing a set of rules where everybody can play and then just stick to those rules that, you know, that's how we're going to do it in Banner's way. So that was just my thought of listening to all the interesting conversation that we have to probably find our boundaries where we want it to be.
That's well said.
Excellent.
I would like to just point to something that this last comment sort of reminded me too that Shiva was just saying. When you're trying to align incentives between the physicians and the organization, it's in building out a culture, it's much easier to align those incentives uniformly in an employed model. For the aligned positions, that creates, in order to align incentives, that just creates more work. So rather than thinking about how to have people, hold people accountable for being part of the culture or building the esprit de corps, I think we need, as leaders, think about how do we incentivize and how do we align, creatively align incentives so that it satisfies the overall strategy and vision that the organization wants to move into.
This is Scott Anderson. There's one other thing I kind of was thinking as we were talking, and I was thinking of the Kodak Corporation, which has invested a lot of money in their brand and really is almost worthless at this point in time. And what that really goes to say is it's not just building a brand, but it's making sure that you're delivering the highest quality product and what people want. And if we look at what sets Banner apart and what is going to set healthcare providers apart in Arizona and in the country, we're in an age of communication right now, and it's making sure that Banner is a leader in providing communication between physicians and between physicians and patients, establishing these patient-based portals, forums for, as Anton talked about, getting in touch with consultants by phone briefly, making sure that we're really communicating with one another and with our patients, because without a high-quality product, you can have the fanciest logo in the world and the best esprit de corps, and you're not delivering what the patients need.
Tremendous.
Well said.
Tremendous comment. I agree. And in fact, if you look at the end of the article, one of the things that even Mayo is still focusing on going forward is how they can communicate better with the other physicians that refer within the network. And I know that that is something that Banner as a whole and that we're trying to figure out here at the Cancer Center is how do you communicate effectively to keep other individuals who refer patients to our facilities loyal. And I think communication, like you said, is going to be at the top for all of us to make sure that everybody feels that they're part of something special, they're part of the highest quality product. Well said.
Any last comments from people?
This has been a fascinating conversation, so I'm glad to have been invited to participate. This is Laura Snell.
Well, sure. Thank you.
New perspectives. Very, very interesting.
Well, thank you. This is our first journal club, and we hope to have this be the smallest number of attendees of any of our future journal clubs. So thank you very much for joining and participating, and I certainly feel like I learned something.
Absolutely, and I want to reiterate to everybody, thank you very much for taking the time out. I know it's the middle of the day. It's hard to find the time that works for everybody, so we just happened to pick one that worked for us. So thanks for showing up. The other thing I want to tell everyone is that we have an official website for our journal club that you should all have a link to. It's ileadsmarts.wordpress.com, and we're going to continue the conversation online. And the goal is really for this to be an ongoing learning experience that just doesn't end at the end of this hour, because there are tons of ideas I'm sure you all have and thoughts you have that hopefully will continue and the discussion will continue.
And please post your ideas and thoughts.
Yeah, and we'll try to do a little summary, hopefully, of what we talked about here, and just as a new post, and we can keep the conversation going at the bottom of that.
Fantastic. I love this.
Great. Any other comments?
No, thanks for taking the initiative to set this up.
All right. Excellent.
Yep, thank you.
Thank you, Don. Good job.
The chairperson has left the conference. The conference will end in 1 minute.